Medrizer Academy for medical assistants.
Healthcare Assistant Interview Question and Answers. Part 3. Being a healthcare assistant, how can you approach for providing emotional support to patients and their families? As a healthcare assistant, providing emotional support to patients and their families is crucial in ensuring their overall well-being. Here are some approaches you can take. First point, active listening. Take the time to actively listen to patients and their families. Create a safe and non-judgmental space for them to express their concerns, fears, and emotions. This simple act of listening can provide immense comfort and support. Second point, empathy and compassion. Show genuine empathy and compassion towards patients and their families. Put yourself in their shoes and try to understand their feelings and experiences. Offer words of comfort and reassurance to let them know that you genuinely care. Third point, be present. Be physically and mentally present when interacting with patients and their families. Avoid distractions and really focus on the person in front of you. This helps establish trust, build a connection, and allows you to respond appropriately to their emotional needs. Fourth point, validate their emotions. Acknowledge and validate their emotions. Let patients and families know that their feelings are normal and understandable. Given their situations, avoid dismissing or minimizing their emotions, or this can make them feel understood or invalidated. Fifth point, provide information and education. Offer clear and concise information about the patient's condition, treatment plan, and progress. Help them understand what to expect and empower them to make informed decisions. This can alleviate anxiety and uncertainty, giving patients and their families a sense of control and support. Sixth point, encourage open communication. Create an environment that encourages open communication between patient and families and healthcare providers. Act as a liaison, facilitating conversations and ensuring that everyone's questions and concerns are addressed. This promotes transparency, trust, and better emotional support. Seventh point, offer resources. Provide patients and their families with additional resources such as counseling services, support groups, or educational materials depending on their needs. These resources can further assist them in coping with their emotions and finding the necessary support network. Eighth point, follow up. Make it a practice to follow up with the patient and their families regularly. Checking in on their emotions, well-being shows your ongoing support and commitment to their care. Remember, professional boundaries may exist between you and a healthcare assistant and the patient or family members. If you encounter complex emotional situations or feel overwhelmed, consult with other members of the healthcare team who may be better equipped to address specific needs. Next question can be, being a healthcare assistant, how can I stay updated with the latest development and advancement in healthcare assistance? To stay updated with the latest development and advancement in healthcare assistance, as a healthcare assistant, consider the following strategies. First strategy, attend continuing educational programs. Participate in workshops, seminars, conference, and training programs specifically designed for healthcare assistants. These events often cover the latest advancement, research findings, and best practice in healthcare assistance. Second point, join professional associations. Become a member of professional association Relevant to healthcare assistant, these associations often provide access to newsletters, journals, online forums, and networking opportunities that keep members informed about the latest development in the field. Third point, follow industry publications. Subscribe to reputable healthcare publications, both online and print, that focus on healthcare assistance. These publications often highlight new research, technological advancement, and emerging trends in the healthcare industry. Fourth point, utilize online resources. Take advantage of online resources such as website, blogs, and broadcasts that focus on healthcare assistance. Many reputable healthcare organizations and institutions provide free access to educational materials and resources that can keep you updated on the latest development. Fifth point, engage in professional networking. Connect with other healthcare professionals, including nurses, doctors, and allied healthcare professionals, through professional networking platforms or local events. Engaging in conversation and exchanging knowledge with colleagues can help you stay informed about the latest advancement in healthcare assistance. Sixth point, follow healthcare news. Stay updated with healthcare news by regularly reading news website or subscribing to newsletters that cover healthcare topics. This will help you stay informed about new treatment, technologies, regulations, and policies that impact healthcare assistance. Seventh point, engage in online forums and communities. Participate in online forums that communities dedicated to healthcare assistance. These platforms provide opportunity to discuss and learn from others in the field, share experiences, and stay updated on the latest developments. Eighth point, seek mentorship. Find a mentor who is experienced in healthcare assistance and can guide you in the staying updated with the latest development. A mentor can provide vulnerable insight, recommended resources, and help you navigate the ever-evolving healthcare landscape. Remember, staying updated with the latest development in healthcare assistance is a continuous process. Embrace a lifelong learning mindset and actively seek opportunity to expand your knowledge and skills in order to provide the best possible care to patients. The next question can be, being a healthcare assistant, how can I handle stressful situation or high pressure environment in healthcare assistance? Handling stressful situation and high pressure environment in healthcare assistance requires a combination of self-care, effective communication, and problem-solving skill. Here are some strategies to help you manage stress. First strategy, practice self-care. Prioritize your physical and mental well-being by getting enough sleep, eating a balanced diet, and engaging in regular exercises. Taking breaks and engaging in activities you enjoy can also help you recharge. Second strategy, develop effective communicational skills. Good communication is crucial in a high pressure situation. Listen actively, ask clarifying questions, and express yourself clearly and calmly. Effective communication can help you prevent misunderstanding and diffuse tense stimulations. Third point, stay organized. Develop strong organizational skills to help you manage our workload efficiently. Prioritize tasks, create to-do lists, and use calendars or scheduling tools to stay on top of deadlines. Being organized can help reduce stress and increase productivity. Fourth strategy, seek support. Don't hesitate to reach out to colleagues, supervisors, or mentors for support and guidance. They provide valuable insight and advice based on their experiences. Additionally, consider joining professional networks or support groups to connect with others in similar roles. Fifth strategy. Practice stress management techniques. Find healthy ways to cope with stress, such as deep breathing exercises, mindfulness, or meditations, and engaging in hobbies or activities that help you relax. Taking short breaks during your workday to practice these techniques can help you stay calm and focused. Sixth point. Develop problem solving skill. Enhance your problem solving abilities by staying updated on healthcare protocol and procedures. Seek opportunities for professional development and training to improve your knowledge and skills. Being well prepared can help you handle challenging situations more effectively. Seventh point. Maintain a positive mindset. Cultivate a positive mindset and focus on the aspects of your work that brings you fulfillment and make a difference in people's lives. Celebrate small victories and learn from any step backs or challenges in encounter. Remember, managing stress is an ongoing process and it's important to continuously access your coping strategies and make adjustments as needed. Next question. Tell me about a time when you demonstrated effective communication skills with an elderly resident who had difficulty expressing their needs. Situation. I was working as an aged care worker and was responsible for caring for an elderly resident who had difficulty expressing their needs due to cognitive physical impairments. Task. My task was effectively communicate with the resident and ensure that their needs were understood and met. Action. I approached the resident with patience and empathy, understanding their limitations and finding alternative ways to communicate. I used non-verbal cues such as gestures and facial expression to enhance understanding. I also used simple and clear language, repeating important information and giving the resident enough time to proceed and respond. Result. Through these communication strategies, I was able to establish a connection with the resident and make them feel understood and supported. This resulted in increased comfort, reduced agitation, and a sense of security for the resident. It also helped me to better understand their needs and provide the appropriate care and support. Next question can be, describe a time when you worked as a part of team to provide comprehensive care for multiple elderly residents. Situation. During my time as an aged care worker, I worked as a part of team responsible for providing comprehensive care to multiple elderly residents with varying needs and preferences. Task. My task was to collaborate with the team to ensure that each resident provided personalized and person-centered care. Action. I actively participated in a team meeting, sharing information and insight about residents' condition, preferences, and care plans that I was responsible for. I worked closely with the other team members such as nurses, doctors, and therapists to coordinate and implement the appropriate care to each resident. This involved regularly communicating with the residents and their families to ensure that their needs and preferences were being met. I also assisted in coordinating and scheduling appointment activities and therapies for the residents, ensuring that they received comprehensive care and support. By working as a part of a team, we were able to provide holistic care to each resident, addressing their physical, emotional, and social needs. I provided support to my colleague by assisting them during their busy periods and communicating effectively to ensure a coordinated approach to care. I also collaborated with other departments such as nursing or therapy to ensure holistic care was provided. Result. Through effective teamwork and collaboration, we were able to provide comprehensive care to the residents. The result, the residents experienced improved outcome and increased satisfaction. Next question. Describe a time when you had a handle to medical emergency for an elderly resident. How did you ensure their safety and well-being? Situation. During my time as an aged care worker, I encountered a situation where an elderly resident experienced a medical emergency. Task. My task was to respond promptly and effectively, ensuring the resident's safety and well-being until medical professionals arrived. Action. I quickly assessed the situation to ensure the immediate area was safe and immediate call for emergency assistance. While waiting for help to arrive, I provided first aid to the residents, all while keeping them calm and reassured. I communicated with the resident, explaining that was happening and seeking their cooperation throughout the process. Result. Thanks to the swift response and effective communication, the resident received prompt medical attention, which ultimately contributed to a positive outcome for their health and well-being. Thank you.